Talking about sustainability now, because I mean this will last for 18 months, and after 18 months what happens? How does CHI ensure that access to medicine translate into real sustainable healthcare improvement for ordinary Nigerians here?
Yeah, thank you. That's a really great question. In our CHI, at the heart of what we do, we say something in our CHI that we try to walk ourselves out of the business. And what does that mean? A key value for us at CHI is we work at the service of government. Okay. And working at the service of government, it's understanding that whatever we do as partners, as NGOs, you are working in a country that is managed by government. It's like we say, soldier go, soldier come, barrack no they move. The barrack, it's the government. Soldiers, NGOs, we come and go, right? So when we think about sustainability at CHI, it's really working with the government to ensure that that system strengthening I talked about earlier, we're working with the government to ensure system strengthening for health. Okay. That way, when we bring things like this in country, it becomes more sustainable. So what will sustainability look for? What would it look like for us from this demonstration study? The output or the results from the demonstration study, and we are able to show that in a resource-limited setting like Nigeria, we can safely administer an advanced medicine like nivolumab. Sustainability starts with negotiations globally. Nivolumab is very, very expensive. The treatment cost for a year, it's over $100,000, right, Prof? For one patient. So it is very, very expensive. And at the heart of what we do at CHI...
How much is CHI investing in this?
We are coming with technical expertise. We're a technical partner, right? So it is not the funding. Yes, it is. We're technical partners. Funding for the program is coming from PICE, and then the drugs are coming from BMS, right? So sustainability, back to the question, sustainability will look like global negotiations to drive down the cost of nivolumab, right? Sustainability will look like policy changes around how treatment, cancer treatment is managed in Nigeria, because we would have been able to show that we are able to safely, use an advanced medicine like this in Nigeria. Okay. So think about policy, working with government to change and update the policy for cancer care in Nigeria. Sustainability would also look like, I've talked about market shaping and bringing down the cost, talked about policy, and even, Nigeria being a hub, right, for this kind of, for this kind of treatment. Because before now, there's no country, at least in sub-Saharan Africa, that has the capacity to do this. So, there's a lot of opportunities that we see from this study that if we're able to demonstrate that, yes, as a country, we have the capacity, think personnel like Prof, and then we have the capacity, we have the institutions, we have the enabling environment that can safely, use advanced medicines that usually will be available in the global north, but we don't have them here. So we are able to show that. And when we think about, I just wanted to piggyback on what I said earlier for sustainability and market shipping. I wanted to give an example of something that just happened recently in the global health space, right? Okay. There is a treatment called lenacapavir. It is a preventive tool for HIV, right? Right now, that drug is for a patient per year, I think it's about $28,000. But because of global negotiations that CHI and other partners have been able to push for, from 2027, we're going to be having those drugs in Nigeria at $40 per year. Wow. Think about it, $28,000 per year to $40 per year. So those are the kind of, when we think sustainability, those are the kind of things we think about at CHI and the possibilities that are possible that can come out from this study.
And what has been the response of policymakers? Because you said you work with policymakers.
It's been outstanding, I must say. If you, for those who were privy to see the launch on October 21st, you'll see that the Minister of State, Dr. Salako, was there, and we have the backing of government. So, again, very important, right? So, in terms of government support, it is there. Government has told us we support this, we're with you fully, and they are looking forward to the result from the study to begin to inform those policy changes I talked about earlier.